If you are new to our webinar series, I want to extend a special welcome to you as one of the premier resources in South Carolina. SC State 1890, as we like to call it, conducts problem-solving research and provides quality outreach services to rural and urban limited resource communities throughout the state of South Carolina. With a nearly statewide impact, we serve 32 of the state's 46 counties in the areas of education, innovation, and support, community and economic development, 4-H youth development, family nutrition and health, and sustainable agriculture and natural resources. Now, before I go a little further into today's program, I just want to lay a few housekeeping notes before we begin. We do ask that you kindly keep your mobile device on mute so everyone can hear the presentation. If you have questions for today's presenters, please drop your question in the chat feature of this platform. And towards the end of the program, when we get to the question and answer session, I will ask your questions to the presenter. Finally, this session will be recorded and provided to our attendees via a link that will be emailed to you. So earlier this month, communities across the country recognized a very special group of men and women, as we do each year with Veterans Day. And of course, during Veterans Day, we honor the more than 17 million brave men and women who sacrificed their families as well as their time to help ensure our freedoms. And so at 1890 Research and Extension, we wanted to use this month's webinar to focus on this particular population. The Armed Forces community is a very special community to South Carolina State University because we are known for producing the greatest number of generals, second to West Point. So that's why it's important for us. Quite often we hear about the health issues impacting our nation's veterans. And one of the things we learned while conducting research on this topic is the sheer number of veterans who are not aware of the types of healthcare benefits and services that are available to them and their families through Veterans Affairs. And so today, what we wanted to do is to provide them with invaluable resources and information to veterans and their family members through the content that they will get through this webinar. So joining us today is Dr. David Omura, who serves as the Medical Center Director and CEO for the Columbia VA Healthcare System. He assumed this position in March 2017 and the same time was sworn in as a member of the Senior Executive Service. In his position, Dr. Omura provides oversight and leadership of the healthcare system. That includes a medical center located in Columbia, 7 community-based outpatient clinics that cover 2/3 of the state of South Carolina. And this healthcare system serves more than 84,000 veterans and has an operating budget of $715 million and is staffed by nearly 3,000 employees. Dr. Omura earned his Master of Science degree in physical therapy from Boston University, his Master in Healthcare Administration from the University of Florida, and his doctorate in physical therapy from Mass General Hospital Institute of Professions. He is active in his community, serving on local, state, and national boards as a member of multiple organizations, including the American Hospital Association, American Red Cross, and the South Carolina Hospital Association. And finally, if that isn't enough, Dr. Omura spends his time training the next generations of healthcare leaders. He serves as an adjunct professor at the University of South Carolina. So without further ado, I am pleased to introduce you to Dr. David Omura. Dr. Omura, thank you for joining us today.
Great, happy to be here, and appreciate all of you taking time out of your day to be here with me today to learn more about veterans and what we're doing across the great state of South Carolina. So I'm gonna work to share my desktop now with you.
Okay.
Just move this over. Okay, so hopefully everyone's seeing, it looks like an overview, an aerial view of our campus. Can everyone see that? Great, fantastic. Okay, so I'm gonna let my colleagues get out of here for bailing me out of the woods, make sure everything worked all right. I'm just moving from one office to another today, so things are a little all over the place. But first of all, again, excited to be here with you today. I know about the great work you guys all do locally across the state, not only regionally, but nationally in many areas. But very excited to talk about the Columbia VA healthcare system and its impact across South Carolina. First thing I want to mention is that we started back in 1932. So before you know it, not too long from now, we'll be at 100 years. So a lot to be proud of here in Columbia, South Carolina. If you've been here and you've seen our campus from Garners Ferry Road, it might not look like it's very large, but it's actually 97 acres. So just our footprint here is 97-acre campus. We're a 204-bed hospital, and we really cater to just under 84,000 veterans. Every year that continues to grow significantly. We have a very big focus on our female veterans. You know, in my mind, our women veterans need just as much TLC as our men. I know in the past it probably was not looked upon that way, but you know, we really want to make sure that everyone that walks in our doors feels that they're receiving the best care possible. And certainly we know we need to make sure we're providing the best care to our female veterans that we can. We actually provide just under 1.2 million outpatient visits a year. So that means that any given day, we're seeing about 3,600 to 3,900 outpatient visits a day. So a lot going on across the state. You heard our budget's over $700 million. It sounds like a lot of money, but you know, think about when you're paying the bills for your house. Just take the house and magnify that a couple, you know, thousand times, and that's what you're dealing with. And we really serve veterans across 32 counties across 2/3 of the state. So very excited about what we're doing to take care of veterans. Now, other than our main campus here in Columbia, we really have 7 other points of care. Again, Orangeburg being an important one. We actually have a brand new clinic being built there, as well as our Sumter, Rock Hill, and Florence CBOCs. They're all approved for brand new facilities. That, in addition to a lot of growth here on campus, are allowing us to make sure that services are readily accessible to veterans as needed. In terms of things that we look at on a daily basis, because we're really no different than what you see in the private sector, we have dashboards that allow us to make sure we're being successful. And I'm going to walk you through a couple of these just to give you some perspective as to the granularity that we look at on a routine basis. So, for instance, here's our outpatient daily snapshot. This is probably a Friday because we only have 2,767 appointments for that day. And what's significant about that is that every day we want to know where our patients are coming from and what services they're receiving. So you can imagine where you're trying to manage an operation, especially during the COVID pandemic. I don't want a lot of people coming through our hospital if they don't need to be here. If we have a veteran that we can take care of through a televideo platform, or possibly they just need some advice via a phone call or something else, we want to make sure we have that readily available. So as you can see in the bottom right-hand side of the screen, we actually have the appointments per hour. And on the far right, you'll see the total appointments in that black line. But then this also breaks out what it looks like from telephone calls, VVC, which is a video call, or other, which is our face-to-face. We're trying to get to the point where it used to be that 95% of what we did was face-to-face, but we realized this is our new normal. We can't have people that are possibly asymptomatic now, but maybe 3 days from now they come down for symptoms that are actually passing on COVID-19. So we want to have as few people coming through as possible. And our goal right now is to flip that around, going from 95 face-to-face to 50%, so we can be successful and continue to move forward without getting people infected and not doing well, whether there are our veterans here on our inpatient or outpatient basis, or our staff that are taking care of these veterans daily. I mentioned VA Video Connect. I'm not sure, again, you can see we're all talking to each other now virtually. I can see a lot of smiling faces on the screen. This works very well. But I can tell you, initially, this was not an easy sell to our staff. Many staff said it just doesn't work. People don't want to use it. They don't like the technology. Well, I can tell you, it used to be prior to March that we did under 100 VA Video Connect appointments a week. And now we're doing 3,600 a week. So it was really a change in the times that need to occur. And what's nice about this data, it shows me not only the services that we're providing Video Connect appointments to, but also lets me look into the next 14 days and also the past 14 days. So I'm a big believer in, learn from your past so you can be successful in the future. So this has been a really good way for us to track this work to see exactly how we're moving forward. We also are very big on testing. Now, I can tell you, I pulled this slide recently for your leadership about a week ago. We're now over 40,000 tests that have been done for COVID-19. And what's important about this is the testing that we're doing, the turnaround time is 1.13 days. So you've all probably known people that have received COVID testing. Sometimes you might get the results back in 2-3 days, sometimes maybe 10 days plus. But for the over 40,000 that we've treated as of yesterday, it's taken 1.13 days turnaround time on average. So we've been very excited about that. That's really allowing us to, as you can imagine, in a healthcare system or even at a university level, if you have someone that's positive, but you don't know they're positive, they're just not feeling well, they can infect a lot of people prior to getting those results. So our focus is getting our veterans results quickly, as well as our staff, so we can make thoughtful decisions. Someone needs to be hospitalized, we hospitalize them. If they have symptoms, but they're not so sick they need to be in the hospital, we can send them home and then follow up with them daily to make sure they're not worsening. And hopefully they can just get better at home and then get back into society later. But this has been very important for us to have this information at our fingertips. We also, this past year, looked to see where we were growing in each of our respective areas. So you can imagine when you're dealing with over 3,000 staff that take care of about 84,000 veterans, I want to know where we're doing a lot of our work and where we need to build more. So this has been a really great way to track our progress pre-COVID as well as during COVID to see what's the gap that we need to create from where we were on our trajectory to how that was impacted by COVID. So when you look at this graph to the very top left-hand corner, it shows you kind of the gap that we have from where we were going to where we are now currently. And the bottom left-hand corner, it can show some areas that we actually made gains. Now, interesting enough, in areas such as primary care and geriatrics and extended care, as well as telehealth, we grew compared to the previous year. And the reason we grew is that we knew we had to still reach out to people and make sure they're getting the care they needed. But as I'm sure all you can appreciate, and hopefully you've done for yourself, you don't want to go into a hospital unless you really need to go in the hospital. It's just not worth it. So we're trying to tell people we can work with you remotely versus coming in here and possibly being exposed to sick people. So this has been really helpful for us to know kind of where we need to get back to in order to be successful moving forward. As far as telehealth, I mentioned how this is so important to us. There are over 152 VAs across the nation. I'm happy to tell you that for the 4 measures that we look at for the Columbia VA, we're in the top 7 in the nation in all 4 categories. So this has been important to us. I can tell you at one time we were probably number 130, 135. But again, I'm happy that our team embraced this so we could be successful and still provide world-class care remotely. And as far as access to care, a lot of you have probably heard about access to care challenges at times in the past for the VA. Well, I'm not sure if people realize this, but the VA sometimes sets the bar so high that when you set it high and you don't meet it, it looks bad. To give you perspective, I know some of you that are on the call today are veterans and some are non-veterans. Well, I can tell you that for myself, I'm a civilian. So when I want to get care in the community, if I want to see a dermatologist, chances are I'm not going to be able to see a dermatologist in 28 days or less. That's because they're hard to get in with. Appointments are not readily available. If I need to see a thoracic surgeon, I'm probably not going to be able to get that surgery done in 28 days or less. Well, in the VA, if you cannot see someone in 28 days or less for specialty care or 20 days or less for primary care and mental health, we have to send you out in the community. So give you the opportunity to be seen in the community, which is great if they can provide those cares timely, but we know that's not always the case. So the good news is that when you look at our access to care, and this is our snapshot as of November 9th, the wait time that we've had for primary care is just above 11 days, mental health just under 15 days, cardiology about 20 days, GI appointments a little over 14 days, and urology 24 days. So I feel pretty good about that. If you want to see us, we can get you in pretty quickly. And those are for new appointments. If you already are in our system, you can be seen by the VA typically in 4 days or less, which is great. You're already enrolled in the system. We have access to all your data. So that's been very helpful. For any of you that are maybe not taking advantage of your benefits as a veteran that would like to take advantage of this healthcare that you're entitled to, and we'd love to provide you. As far as some of our unique capabilities, if you get tested out in the community, a lot of times you're receiving antigen testing. If any of you have had this, you know that it just tells you that you're positive for something. It might be that you're positive for either a viral or bacterial pathogen. But if you're found to be positive, you then need to go back in and actually have a COVID test to see if you truly have the virus. Well, what we do here is we actually do a respiratory panel where we will test you not only at one time for COVID, but also test you for the flu, for pneumonia, for actually 18 unique pathogens, both viral and bacterial. So you can imagine how much more convenient that is versus someone saying, well, you don't have the flu, but what else do you have? You still feel miserable. You're still not doing well. And at the end of the day, we want to make sure that we're getting the care for yourself or a loved one, that you know what's going on. You create a plan of attack so you can be safe and your loved ones can be safe. So we feel really good about that. We've also started doing robotic surgery. And I'm sure you can all appreciate that although I like humans doing things, we don't want to be replaced by robots, but understand that's not going to happen. This is just a robotic guided device that when we work on patients, we can get to the very smallest level to make the right incision or to put on the right clamp or to make put the stitches in the right area on maybe that blood vessel. So this has been a great opportunity for us to advance our technology using robotic guided assisted procedures. And also, I think what's great about the VA is our comprehensive mental health services. I'd like to think that mental health is becoming less and less stigmatized. Certainly in the VA, we promote to everyone that we all have challenges. At times, we need someone to talk to. And we would like for people to embrace that and help people to understand that we're all in this together. So if anyone's having a challenge with a mental health issue, whether it's something that you might think is something that possibly is very large in terms of overall significance, I want you to know that the VA provides the best mental health services in the nation. When I work with the private sector, I'm told very frequently by Thornton Kirby, who's the president of the South Carolina Hospital Association. He always says, I wish we would just give all the mental health to the VA because you guys seem to know what you're doing. You have the resources, you have the bandwidth to be successful. So I'm very proud about what we do, not only for able-bodied veterans, but for those that are possibly down on their luck. Maybe they're homeless. Maybe they're having a problem with just finding a job. We have resources to help put people in homes, to help find jobs for people. So it's been a really great resource as a whole, following a whole health approach. As far as the organization structure for the VA, I want to list this slide because I think sometimes people don't realize who we report to and how things work. We really start with the Secretary of the Department of Veterans Affairs, and that is Secretary Wilkie. His home base is in DC. Then below Secretary Wilkie is the Under Secretary for Health, Veterans Health Administration. Then it falls to the deputy. Then it really falls to a regional level. So although I'm the CEO and the director of the Columbia VA, there's 8 healthcare systems between South Carolina, Georgia, and Alabama that all fall under Veterans Integrated Service Network 7. So there's actually 18 of these across the nation. But again, myself and 7 other CEOs fall under Vision 7, and they're the ones that help provide us additional guidance. And then the last level is me, where I manage things locally here for 2/3 of the state. Now, I can also tell you that although they're not my direct boss, I get a lot of people who feel like they're my boss, and that's okay. I think you guys all can appreciate that as well in academia and everywhere else. I get a lot of politicians that reach out to me. I get, a governor that might reach out to me, and that's fine. My feeling is maintain good open lines of communication and just show you're being a good partner. And usually if that happens, people get off your back, usually in much better shape. But there's certainly a lot of people that think they're my boss, but this is my true line of authority. As far as partnerships, again, I look at this as being a great partnership. Happy to work with our local universities, find ways in which we can be stronger together. But this just lists several of our community partners, whether they're in the Department of Defense, whether they're part of a healthcare system, or they really serve as one of our veteran engagement councils. We have 4 veterans engagement councils that cover the entire state. And those are really great where we have different leaders who can kind of be the pulse for what's happening in the community. And also gives us an opportunity to provide more routine feedback as to what's working well and what are the areas that we're trying to get better in. So this is a great opportunity for us to be better and more successful as one unit. This is just a slide that shows kind of some of our changes. We actually have $160 million in approved projects. So when you come onto our campus now and you see it 2 years from now, it'll look nothing like it looks right now. So we have a brand new behavioral health center of excellence, another parking garage that'll be started in the next 3 months, prosthetics building, a rehab building, a specialty care clinic, a Fisher House, which is really just almost like a bed and breakfast for veterans. Their families can stay there free of charge while maybe their loved one is receiving cancer care at our facility or possibly in our long-term care facility. We're bringing back, if you're familiar to Columbia, there's this one building you can see from Garner's Ferry Road. It's called Building 10. It's a 20,000 square foot building, 3 stories high. Many years ago, it's falling apart, but I was able to receive the funding to bring that back to its former splendor. So I'm excited to have this beautiful building, which is flanked by columns on both ends and in the front. That'll be back up and looking like it did in 1932 this May. So I'm very excited about that. And then, as I mentioned earlier, 4 of our outpatient clinics are all expanding to 3 to 4 times their current size. And those are all getting started this year. So I'm very excited that all these projects are breaking ground this year. And in the next 2 years, you'll see them all either erected on this campus or located across the state. A lot of people ask me frequently, what's the basic eligibility requirements to be part of the VA? And as far as basic eligibility, it's really, did you serve in the active military? So any of the branches, and were you separated under any condition other than a dishonorable discharge? If that's the case, you may very well qualify for benefits. Now, I can also tell you that current and former members of the Reserve or National Guard who are called to active duty, other than for training by federal order, are also eligible. So please, if you're interested, you can reach out to me, send me an email. You can also call our main number, and we can help you to navigate that process. As far as the minimum duty requirements, most veterans who are enlisted after September 7th, 1980, or entered active duty after October 16th, 1981, must have served 24 continuous months. So that's the catch. It's a 24-month period. This minimum duty requirement may not apply to veterans again, who are discharged, or if you were in the middle of your training, so your initial training for the military, and you were injured, you very well are entitled to benefits as well. The exception to these also are focused on other duty requirements. So we really would like you to reach out to us so we could talk to you about your unique situation. Many people will show up just where they're DD 214, and from there we can take it away and see exactly what you're eligible for at this time. As far as returning service members, we also have our service members who have returned from combat after November 11th, 1998. For an extended period of time, you're actually eligible for health care for up to 5 years after your discharge. And this special eligibility includes cost-free care for healthcare service and nursing home care that are possibly related to your combat service. In terms of enrollment, you would be part of Priority Group 6, and that's provided for 5 years from the date of your discharge. For healthcare not related to combat service, co-payments may be required. Now, I can tell you the co-payments here are really based on your need. If you had a service-connected disability, you'll never pay a co-payment. But if it's for something that you are not service-connected tied to, you would then be tied to a co-payment when you come in for your care. But that can be managed through your social worker. And there's many reasons to enroll. So first of all, I think it's important to recognize that VA healthcare meets the minimum essential coverage requirements under the Affordable Care Act. We also are medical care rated among the best in the United States. When they look at quality data, both for inpatient and outpatient services, we always outperform the private sector, which we're very proud of. There's also no open enrollment season. Veterans can apply for VA healthcare at any time. There's no enrollment fee, monthly premiums or deductibles, which are important because when many people are carrying their own insurance, it typically gets older as you move along in age and have more challenges in your life. For the VA, you'll never have that. There may be a small co-payment and a cost to prescription drugs, but in many cases, this is either a minimum or very low cost in general. There's more than 1,700 VA medical facilities across the nation. So that means that if you're enrolled in the Columbia VA, but you're going to go visit family in California for a few months, you can get enrolled there and receive those services as well when you move. There's also the freedom to use other plans with your VA healthcare, including Medicare, Medicaid, and TRICARE, as well as private care insurance. So I tell people routinely, if they're receiving care at Fort Jackson, they can also be enrolled here. And it may be that at that time, if Fort Jackson is overloaded and they need support here and dental or possibly get their medications, they can work through us to get those medications or those dental service or whatever that may be based on their level of interest. And then also what I think is important is for people to recognize that the VA offers a comprehensive medical benefit package that is generally available to all enrolled veterans. And that's important. Really, whatever your comprehensive needs are, we typically have a service that's readily available here, or if we can't provide it here, we'll make it you eligible for care in the private sector. As far as enrollment or demographics update, it's easy to enroll. You can just connect to us on the web at www.va.gov. You can also complete the 1010EZ and fax it to us if you'd like to send that to us via that method. And you can also mail it to us. So it really just depends on how you would like to reach out to us to make connection. We also have an eligibility and enrollment personnel that can answer more specific questions at the 803 number listed below. And then you can also reach out to our Health Eligibility Center through our HEC, and that's at the 404 area code listed in this presentation. And that's it. I just want to provide some of those general overviews on how you can access us. I can tell you I'm very proud of what our team of about 3,000 employees is doing. But again, I mainly am proud because I like taking care of veterans. I want to make sure that we're working collaboratively to be successful. And I can assure you, if anyone ever has any concerns or anything else, we want to make sure we address those concerns. We get people responses timely. And again, I am happy to take any questions or comments at this time. So I'm going to turn it back over to you, and and I believe I'll be walked through this Q&A session.
Yes, thank you so much. We do have some questions coming in. So the first question is, when do you recommend enrollment?
I really recommend enrollment at any time that best suits you. Because there's no enrollment period during the year, it's really based on what's most convenient for you at any time. I do recommend you do it sooner versus later. The best example is that every once in a while, and actually when I say every once in a while, it probably happens at least 10 times a year, we'll get a call from someone who's maybe in like their 60s, 70s, 80s. They're all of a sudden not doing well, and they're starting to build up a lot of expenses, and their private insurance will no longer cover it, and they're entitled to VA benefits, particularly if someone needs to be put in a nursing home or a skilled living facility. Those are very costly facilities to receive care in. But if you are 70% service connected or more, you're entitled to 100% coverage in a long-term care facility. And I can tell you, some people think, well, I would never go into a long-term care facility. Or we always have people say, well, I want to take my mom or dad to live with me. Well, when you realize that possibly your parent is fully dependent on bathing, bathroom needs, they can't do much of anything on their own, you're going to want to make sure you get some help. And quite honestly, they could come into one of our facilities to receive that care, or we could send someone to your home that could provide that care for you in their home at any time. So I think there's a lot of benefits that are very beneficial. I also know that getting medications is very helpful through us. There's a My Healthy Vet program, and I'm sure there's probably some people that are veterans on this call that have used My Healthy Vet. We turn around that feedback typically in less than 1 day. So if someone needs to get their meds updated or something else, we can help them out. We can have it sent directly to their home. There's a lot of great things we can do. So I would take advantage of that benefit. Many of you have served our country, which we greatly appreciate. And the least we can do is to offer you these healthcare benefits when you feel you need them.
Great. Thank you, David. I forgot to ask you to, if you could stop sharing your screen.
Okay.
Thank you so much, Dr. Moore.
You're welcome.
So the next question is, does the enrollment period have an end date?
It does not. There's no end date for any enrollment period. Enrollment is any time that you'd like to do it throughout the course of the year.
Okay. Do you offer services to the spouses of veterans? And I'll go a step further. And if so, what are some of those services that you provide? I know that there was a new law that was recently passed too. I can't, with the family support services.
Sure, that's the caregivers program. And we have a multitude of services that will actually pay that family member to care for the veteran, or will actually pay an agency to come into the home and provide those services. So it really depends on what's best for the family. But we have independent assessments that are done, and we're happy to provide those services. What we would do is when you enroll, we connect you with one of our social workers. They would do a full assessment and determine how to best move forward.
Okay. Talk to us a little bit, if you can. You mentioned the Orangeburg facility. How will that benefit our community? Because SC State, of course, the main campus is located in Orangeburg. So what type of impact will that have in Orangeburg?
Well, the first thing it's doing right away is that as it's being built, it's going to bring in money to Orangeburg in terms of just offering jobs. Just building a building, getting, helping to revitalize an area, because you know how it is. You can build a building that is, a crummy little space in a strip mall that doesn't look too good, or you can build something that actually looks great, right? So this is going to be a freestanding building. The size is going to be upwards of about 30,000 square feet. So this is going to double. It's going to actually be 3 to 4 times its current size. And we'll be hiring a lot more people to work there, whether you are someone that's a doctor, a nurse, a health tech, a social worker, people to schedule patients, or medical support assistants, housekeepers, police. I mean, these are all the people that kind of go into a job like that. So, and then we'll be setting up contracts for people to help out with other services that help to maintain the building. So it's going to offer an influx of jobs to the community, but it's also going to be just a great resource for veterans. I mean, something you can all be proud of. So we're excited about it.
I noticed that in your slide that showed, I guess, your footprint, you have footprint in Sumter and Anderson, and these are all areas in which we are located, at least our some of our regions. So are there specific issues relative to those areas that our extension agents need to be aware of if they were considering looking at potential programs to partner with VA?
I think the sky's the limit. So to give you perspective, when we're opening up these brand new facilities, I have right now some students that came through our volunteer program, our student volunteer program, that they liked it so much that they're now still volunteering while they're in college. Tammy Finney, who oversees our program here for our stakeholders and voluntary services, her son was actually the volunteer of the year for the VA, received a $20,000 scholarship, is now going to Furman, and is still volunteering at our Rock Hill clinic. So there are lots of opportunities to partner and give back and have a rich experience. And, whether there's people at your school at South Carolina State that are interested in, let's say, business or interested in medicine, there's a lot of ways in which we can partner to give people rich experiences that they can either use to take on to go into the private sector or possibly stay and continue to serve in the federal government. So I think there's a lot of ways to partner where we can both be successful.
Awesome. And going back to expansion, one question, do you all foresee any expansion in the Low Country?
So the Low Country is really the Charleston VA. So where we cover 2/3 of the state, we give the other third to Charleston and the coast. So they really cover the rest of the state, and they have a great facility, and they're growing leaps and bounds as well. But between the Charleston VA and the Columbia VA, we're going to have this whole state covered in the next couple of years completely. We have a brand new facility that we're looking to build in Lawrence County. The reason why that's important to us is that when you get between the upstate and the Midlands, you have this area that's not being really covered as well. So we would like to build a healthcare center there where we offer ambulatory surgery, full diagnostic imaging, primary care, mental health, and specialty services. So that's on the horizon for us, as well as we want to offer more comprehensive oncology services here in Columbia. So we're looking at building a linear accelerator, which will allow us to provide comprehensive oncology services. But Charleston is growing by leaps and bounds as well. So, just a lot of good things going on.
Do you offer any wellness programs for veterans? And if so, what are some of those programs?
We do. We offer many wellness programs. We have a really whole health approach here. And we have a program called the MOVE program, which teaches people how to stretch, how to exercise, how to use, healthy habits. And we've had a lot of veterans that have really turned around their life. Were diabetic or no longer considered diabetic. They are now lost a lot of weight. They just feel better in general. And that's really through these programs that really empower people to be successful and just learn more about good nutritional and dietary habits, better ways to exercise, and even just mental health, whether that's through Tai Chi, yoga, etc. We have all of these whole health programs that we feel have been very successful.
Talk to us a little bit about, you talked to us about COVID And how has that affected the veterans population, especially those with, of course, pre-existing conditions?
Sure. It's amazing, but COVID is something we have to take very seriously. I don't know how all of you are looking at it. I think everyone has a different perspective. I can tell you, I'm in my office now by myself, so I'm not wearing a mask. The reality is that when I go out, I'm wearing a mask everywhere. The fact of the matter is a lot of people are not taking this pandemic as seriously as they should. But we take it very seriously here at the Columbia VA. As a matter of fact, you are not allowed to walk into our building unless you have a scheduled appointment. So we don't have walk-ins anymore. We need a scheduled appointment because we can't have someone in our building walking around and going all over the place that doesn't need to be here. That's the reason why we made a concerted effort to screen every single veteran when they come in through only one entrance of our hospital, and everyone gets screened. We also purchased the technology that TSA was using in the airports. And when you walk in our building now, it tells you your temperature on a monitor. So you basically have a video camera that zaps your forehead and tells you your temperature before you even get in front of us, which has been very helpful. Because if someone has an elevated temperature, we want to make sure we back off from them as quickly as possible and get them the care they need. We also are now here making sure that if you are coming to the facility and you're not feeling well, that we get you tested immediately. As I mentioned earlier, I'm sure some of you have received tests that are all different ways. There's saliva tests, there's the nasopharyngeal test, there's the oral test. I can tell you some of these saliva tests are not very good. Some are good, but some are not very good. So we got to make sure, first of all, you're getting a good test. Make sure that you know what the sensitivity and specificity of that test is. If you find out there's a 50-50 chance it's giving you accurate results, that's not very good. All of ours are 85 to 90% accurate, which is the best you're going to find right now. And when we do testing here, we can get your results back quickly because you can imagine, I'm sure some of you have had some loved ones that have gotten really sick. I guarantee some of you have lost loved ones as well, which is unfortunate. But think about if those individuals received their results more quickly. If they could have received the convalescent plasma, the other interventions that are actually helping to save lives, that makes all the difference. And we make sure that everyone that comes in our facility wears a mask. If you don't want to wear a mask, we tell you we're sorry, but we can't treat you. That's just the way it works because we need to protect each other. So I feel we've done a very nice job and continue to move forward. I know the private sector, they're pretty happy to see anyone. You don't have to always wear a mask. You don't have to be tested. It's a lot looser, but I think our veterans deserve better. So we're going to make sure that every single staff member is tested if they have symptoms immediately. We make sure that if people can work from home, we find ways for them to work from home as long as they can be productive. I'm not going to have someone go home and pay them to do no work. But if you're willing to do work from home and be successful, we will pay you to do that. But those are the changes we have to all make. And fortunately for here, we've really thrived. We're in the community. I'm not sure how closely you guys look at the results, but I look at them for the entire state every day. Our positive rate in the Columbia VA for staff is less than 0.5% of all of our employees have been positive. So again, less than 0.5%. Every day in the community when they're doing testing, it's anywhere from 12 to 24% every day positive rate. So I can tell you it's a lot safer you walk in our doors than you're walking out in the community. So I tell our staff that all the time, and we're going to continue to maintain that level of safety by continuing to test, we continue to use PPE, making sure people have the resources they need, and also continue to promote telehealth. Because you know what, everyone doesn't need to come into the hospital. How many of you have hurt your neck, or you want to just get some medication that you knew would work because you have a little bit of a medical background? Wouldn't you rather talk to someone like we're talking right now, talk about your symptoms and get what you need, versus going to a hospital where someone's coughing next to you or someone's feeling miserable? So, it's a lot of common sense needs to be used. And I feel like we're doing that currently in our environment.
Oh, that's great to hear, Dr. Moore. Thank you so much. Do we have any more questions? Just take a few seconds to allow others to submit their questions in the chat feature.
And I can see most of your smiling faces, so feel free to ask any questions on your mind. There's really no bad questions, in my opinion. I believe in the VA we have to be transparent and let people know exactly what's going on. So if there's anything on your mind, if it's a personal question and you need me to help you out with anything specifically, I'd rather you reach out to me directly, and I guarantee you will hear back from me. You've got your leadership on the line to hold me accountable to that promise. But I'm happy to answer any questions you may have.
Okay. Okay, one just came in. What community partnerships do you have throughout the state? I know you had a list of partnerships, but of course, being an organization that works in the community, in reaching various demographics, talk to us a little bit about partnerships that you have, and maybe even some special programming
Sure.
that VA may have.
Sure, happy to do that. Well, let me emphasize again that if any of you have kids that are interested in a student summer program, we offer a phenomenal program for children. You have to be 13 years old. It's 12 weeks long. The children are not committed to being here every day. They might say, I'm going to come in 2 days a week, 3 days a week, whatever that may be. But we will take care of your kids like they're our kids. We want to make sure that we're helping to make them feel good about themselves. We want to offer them rich experiences. A lot of times, if they're interested in medicine, they want to see a surgery, we'll have them watch a surgery. If they're interested in building buildings, we'll have them work with our engineers. If they want to just do some interesting things like get CPR certified, we'll get them certified. So there's a lot of cool things you can do that I'm sure we all know. My son's 12 years old, just turning 13, so it'll be the first year he can do it. But there's plenty of better things you could do than most kids do during the summer. So I think that's a good opportunity. Secondly, we have a very strong relationship with the DoD. General Beagle at Fort Jackson, I work very closely with him. He's a great individual who's committed to our military, committed to our community. So great relationship with him. And we work on a lot of collaborations back and forth where we provide services to each other tied to healthcare, as well as education of staff. We are closely tied into the Chamber of Commerce, closely tied into the South Carolina Hospital Association, as well as the American Hospital Association. I'm on boards for both of those organizations. So I'm at the table talking about how do we make things better. I routinely talk to the governor. I routinely work closely with, whoever happens to be in a political appointed position at that time. And if things bubble up and they have problems, I'm happy to answer them. But, we're just always looking to partner with people. I mean, I'm a big believer in we're stronger together. And people that usually think they have all the answers usually are not very successful because they think they have all the answers. But I'm a big believer, and there's a lot of strength in numbers. So we have hundreds of academic affiliations. So we work with schools across the nation that send students here for us to work with.
Okay. If we wanted to provide educational services through the VA, who would we need to contact or seek at local VAs?
Yeah, what I can do is I can reach out to you after this call, and I can send you the name for Miss Tammy Finney. She oversees that department, and so I'll send you all of her contact information. She's a wonderful person, is a great resource, and she can connect you into anyone at the organization, or possibly in most cases handle the questions herself.
Okay. And I have a question here asking for more information. I'm trying to find out which program do they want more information on. I'm going to assume the program that you mentioned, the professional development program for young people.
Yes.
You have more information on that you can maybe send to me afterwards, and I can forward it.
I sure can. Okay. I will get that to you. That'll be Tammy Finney again that oversees that program. Okay. But she'll be happy to get that out. It was very disappointing to me with the pandemic. which I think we all thought this summer was our peak. And I guess for South Carolina, it still was. I don't know how many of you guys follow this, but we were seeing about over 2,000 cases a day, and at our peak. Fortunately, now it's not as bad, but it's getting bad. Again, I have a feeling we'll hit that number again in the very near future, similar to the way it looks across the nation. But this past summer, we could not have our face-to-face program. We just didn't feel it was safe. We did a virtual program, which only handled a few students. But we'll see how things work. I'm hopeful if everyone starts wearing their masks again and stops having these big group gatherings. I can tell you I'm from a family of 10 myself. I love my family. I'd like to see my parents, but I also love them enough that I don't want to see them now. So hopefully they're safe in the months to come. I really do believe that we can get out of this in the next several months if we just use good social distancing, utilize appropriate PPE, and just make just good decisions, kind of common sense decisions. We can be in better shape. But yeah, that's kind of where we are at the summer student program.
Awesome. We definitely know the disappointment of not being able to host summer programs for youth, because we have summer camps for youth, and we had to cancel ours. But we were able to be creative, just like VA. We had some special programs virtually. So we all have to pivot.
That's right. That's right.
This time. Well, I think that's it, Dr. Mora. We don't have any more questions from attendees. And I just want to thank you again for taking the time to share with us the resources and information about Veterans Affairs. A lot of our agents and directors are on the call with us today, and they meet all types of people and work in all the communities. And so it's important for us to just have a good understanding of what's available to those individuals that we serve. So thank you so much for your time.
My pleasure. Again, this is really your VA. So if there's anything we can do to make things better for you or anyone please reach out to us. We're always trying to evolve and get better. And I really want this to be the best VA in the nation. So we're going to work hard to make you proud and serve you in any way we possibly can. And I want to thank you all for your time today, and look forward to hearing from you in the future.
Awesome. You definitely will. Thank you so much.
Okay. Thank you all. Hope you have a great day.
Thank you.
Okay, take care, everyone.
For joining us.